The high demand for services of health workers in developed countries is giving rise to the wave of Ghanaian health workers migrating. Experienced nurses are living in drones with the expectation of better working conditions, flexible work schedules, and better pay in the foreign countries. The exodus of nurses is depleting critical units of some health facilities in the Ashanti region, where 304 nurses have left for abroad in the first quarter of 2023 alone. Regional Director of Health Services, Dr. Emmanuel Kojotinkran, laments the situation.
Now it's close to about 10 a day because as at the first quarter, we've lost over 304 nurses who has requested for leave without pay for various reasons. Meanwhile, most of the reasons is that they want to travel outside the country. That's what they are going to do. Well, you know, maybe they are going for greener pastures and other things. And those who are going are, let me say, the best that we have, because these are the people that we've trained for years. They've acquired the knowledge, the skills, and then the right attitude to manage cases. And these are the people that will be accepted by the foreign world.
Most of the nurses are now vacating their posts under the guise of going on leave. The situation has left some facilities with few staff to man critical units such as maternity, mental health, surgical wards, and theaters. One of such facilities is the Kumasi South Hospital, where the exodus of critical health professionals is a daily phenomenon. Dr. Nana Kwesi Blankson is the acting medical director.
Even on daily basis, we have nurses leaving our facilities. There are days that we have meetings with people, or you go on monitoring and you meet certain nurses, and by the next day you can't find them and you are told that, oh, they've migrated to seek greener pastures. So it's basically just like a rapture. What we know is that most of them will apply for leave without pay.
10 out of 18 personnel at the surgical ward have left their posts this year alone. Acting nurse manager Victoria Safua Osei is overwhelmed.
It makes the work difficult. Right now we had wanted to have another unit, but because we don't have enough staff, we can't do that. You overload yourself, and then at the long run, you will see that maybe you won't be productive.
Are there instances where you'll be there and you will see complaint that we are short of team members, as let's say Unit A or Unit B, because of the exodus of these
Yes. The male surgical ward like this, we're having about 20 nurses there, but currently we have only 8 nurses. So look at the gap. It's not easy.
There are concerns quality care could be compromised as the few available hands are overburdened. Dr. Blankson explains.
The health of our patients is our concern. So we try as much as possible to adapt. Obviously, nurses and other cadre of staff have to take on additional roles, responsibilities, and duties to make up for the loss. But then if you do that for long, it will obviously have a toll on you.
The Ghana Health Service appears to be helpless in finding an antidote to the brain drain. Deputy Director General Dr. Anthony Ofosu Adolfo says there's little the service can do to stop staff who are motivated by money to travel abroad.
What is pulling them, and that is the pounds and dollars, which we cannot match. So the pull factor is huge. Yes, and I mean, so if countries have gaps and they have more money than us, they will attract more than we can attract, like the UK, US now. After the COVID, they have huge gaps in nurse availability. So they want to fill it. So once they are offering more, our people will move. If we give a thought to it, something can be done. I mean, I think those are the things that we try to think about. Facilitating access to quick training. I mean, those things are within our means.
From Kumasi, for Joy News, Oyeminteria reporting.